It is actually a small retrospective study where we actually looked at, if I remember well, 17 patients or 15 that actually we had a suspicious, suspected diagnosis of thrombotic microangiopathy after allogeneic transplantation. This is a very rare complication, and EBMT last year released a guideline in order to diagnose, harmonize the diagnosis of thrombotic microangiopathy following the papers of the classification from Sonata Giodele. And basically what we try to do, since the Giodele paper was based principally on pediatric patient, we try to look at adult patient, try to see if the EBMT new guideline were helpful in order to diagnose, identify patient with thrombotic microangiopathy after transplant. And actually, so we following this criteria, we actually looked at these 15 patients. Some of them satisfied at least 4 criteria to diagnose thrombotic microangiopathy. And we looked also at complement activation in these patients. And we actually observed that C5b9 complement factor was actually increased, especially in this patient with more than 4 criteria, who had more than four criteria for diagnosis of thrombotic microangiopathy. And also what we observed that this patient had a very much worse prognosis compared with the other ones that didn't satisfy the EBMT criteria, so that we had less than 4 criteria. So the ones that had more than 4 criteria had a much worse prognosis compared to the other ones. So confirming that these criteria actually are very helpful to identify patients who are at much higher risk of dying, and probably help the clinician to diagnose thrombotic microangiopathy. And also what we observe also is that the complement activation is actually probably very important to in this patient to give a worse prognosis.